Hey guys, I'm Dr. Jeremy.
Dr. David here.
We're from Sprouting Health Chiropractic and Kinesiology in the Hunter Valley. And today we're going to talk about TMJ disorders. So what is TMJ? TMJ stands for temporal mandibular joint, and it just means the jaw joint. And a lot of people can have TMJ issues. It creates things like clicking, pain in your bite. It might lead to a headache. It might lead to feel like you're grinding at night. Often it will just wind your brain up too. So neurologically, the TMJ has some of the most input into the midbrain, which is why we get headaches as well with TMJ issues.
100%. So you can actually put in 2 fingers around here, around your jaw, and you open and close, you feel where the TMJ actually is. So what causes this? Some potential causes about this is misalignment of the jaw, right? So different muscle tension on different sides. You know, if you have one side that you favored to chew on food, you know, you use one side more. You know, the way that you sleep on one side a little bit more, and that can also affect the alignment of the jaw. We're also talking about stress as well. Stress is a big one. Often we see people with bruxism, which is teeth grinding and clenching in the jaw, and that can result from extra stress into the TMJ as well. What else? Arthritis, overuse, wear and tear.
Posture. Posture's a huge one.
Absolutely.
So we know that if our posture's out, our jaw has an automatic correlation to where we are in space. So you can see that's really obvious. So what's some things we can do? Well, leading on from the posture, well, as we look at your biomechanics of your neck, shoulders and upper back, and even your low back can have a massive input onto what the jaw's doing. So that would be the first port of call there that we look at. David already mentioned the emotional part of things, and there's things we can do to help you manage your emotion differently. We have techniques in here to help manage that.
Absolutely. So some relaxation techniques really helps with jaw clenching and bruxism. Okay, some gentle breathing techniques, things like that can sometimes really helps. Now the other thing is when we're talking about there are some weakness in our body, right? It doesn't really matter what, you know. It could be a lower back muscles. It could be some arm muscles. Because when I say this, you'll understand, is that when we open up a glass jar, we often go, we clench the jaw, right? So what happens with that is, clenching the jaw actually makes us a little bit stronger, right? So when you find yourself clenching your jaw and grinding your teeth quite often, it can be an indication of there are some weakness going on in the body, something funky going on.
That's a really good point. Yes. And so we know, and that's why jaw and whole functional neurology is very much related. If you're going to get some work on your jaw, we really want to be seeing someone who understands how jaw changes neurology. And for that reason, when we identify all the other things in here that we can deal with, once we've identified that there may be a malposition or an actual physical jaw issue, that's where we send you guys to a functional dentist, someone who actually understands how your jaw affects the brain. Really, really important. And if we need to refer you on, we will definitely do that. But if you want any other questions or any other advice, make sure you book in, see one of our doctors of chiropractic here in Hunter Valley or Newcastle. And we look forward to seeing anyone with jaw issues, because it's something that we just don't want to put up with. It causes a lot of deeper issues with your neurology that most people are probably unaware of.
100%. See you guys next week. Thank you, Dr. Jeremy.
Thank you, Dr. David.